You're listening to Fast Facts, Ask the Expert with Katrina Sanders.
Hello, and welcome back to Ask the Expert. My name is Katrina Sanders, and I will be your expert this week as we unpack a question that I do believe a lot of dental professionals think they already know the answer to. However, the real answer will surprise you, and that is, at what age should children first see the dentist? Now, if you're anything like me, when you were in dental and dental hygiene school, you were told the proverbial 3 years of age, that at 3 years of age, that is the first time that we should optimally see our patients, our young, teeny tiny patients, for their very first visit. However, new data actually indicates that we should be seeing our pediatric patients sooner. Check this out. The American Dental Association actually recommends that children have their very first dental appointment by their first birthday. Diving a bit deeper into this, the American Association of Pediatric Dentists says it can be when their baby teeth start to come in, which really is around 6 months of age. During that first visit, it becomes critical for dentistry to help identify potential sign stages or symptoms of baby bottle tooth decay, infant feeding practices, the habits of mouth cleaning, talking to mom and dad about teething, pacifier habits, finger or thumb sucking habits. The list goes on and on. During that first visit, which can last anywhere between 30 to 45 minutes, that complete exam of the teeth, jaws, bite, gums, and oral tissues allow the treating dentist to identify early sign stages or symptoms of disease. And what's more, it certainly can help our young pediatric patients to feel more comfortable and confident with earlier experiences in the dental chair. In addition, with the integration of things like oromyofunctional therapy, now we're beginning to identify the role that dentistry can play in critical parafunctional management, malocclusion management, as well as airway management. Now we can start to look at these tethered oral tissues and start to address these needs while the skull is developing. Finally, we've started to see some compelling data that actually indicates that as we're young, our oral and subsequent systemic microbiome is developing. By the age of 3, our host microbiome has been completely developed and formed. And so if we can see our young pediatric patients before the age of 3 and start to address oral health issues or complications, educate mom, dad, or caregivers on proper oral hygiene habits, and start to develop these optimal dietary and lifestyle educational pieces, we can help improve the lifelong display of oral health for our pediatric patients. Well, thank you for joining me, Katrina Sanders, for another episode of Ask the Expert. I look forward to seeing you next month for another fabulous episode.
Please feel free to reach me on Instagram at The Dental Wine Genist or on my website, www.katrinasanders.com. Cheers.
Thank you for listening to Fast Facts, Ask the Expert. If you have a topic you'd like one of our experts to answer, simply email me, Andrew at ataleoftoahygienist.com, and we will get it on the air as soon as possible. Thanks for listening.